So the difference between the secondary and primary is primary respiratory motion is mitigated not only by dural tension, but the flow of CSF. So when CSF is stronger, or there's more CSF, I should say, in the sacral well or the lumbar cistern, there's slightly less in the cranial vault. And then when this lumbar cistern gets compressed by the movement of the sacrum, it pushes CSF into the cranium, and that expands the ventricles. And when the ventricles get to a certain set pressure point, the body stops producing cerebrospinal fluid in the choroid plexus, and then the cranial vault starts to shrink as CSF is pushed out through the lymphatic system as well. And that whole motion of CSF is mitigated by CSF pressure gradients, which vary only about 5 to 6 millimeters of pressure of water. But that underlying motion is constant. So where secondary respiratory motion gets triggered by respiration and the speed of respiration, primary respiratory motion is always 8 to 12 times per minute normally, and that stays that way throughout life, regardless of your age. Because what happens is that motion is mitigated, as I said, by the pressure of CSF. And the other thing that happens is CSF is exchanged 4 to 5 times a day. So in other words, the volume of CSF in the system is pushed out of that system and works as a lymphatic system and is replenished 4 to 5 times a day, every single day, regardless of age. So when CSF is moving through the system, it creates this kind of fluid wave motion. Obviously, this is faster than 8 to 12 times per minute, but these are the mitigating factors. Is the pressure within the ventricles will control the amount of CSF pressure. And the other thing that affects it, of course, is the dural meningeal system. Tension in the dural meningeal system can affect CSF because it can change pressure gradients. If there is constriction in that dural meningeal system, it can create false increased pressure either in the sacral well or in the cranial vault, and that will change the way the body produces CSF through the choroid plexus because it's going to change the pressure gradients.